Welcome to our Joseph Brand Hospital webinar series for patients with COPD, patients and their families. Today's topic is anxiety. We're going to look at the definition, anxiety and how it relates to COPD, signs and symptoms of anxiety, coping, managing, anxiety breathlessness cycle, common medications for anxiety, complementary therapy, exercise and anxiety, and then at the end we have some resources for you. So the definition of anxiety. Anxiety is defined as excessive worrying about present and future situations, which in turn causes the person to feel anxious. Compared to occasional feelings of stress, anxiety can occur daily and last longer than 6 months. Anxiety is persistent and affects our thinking, behavior, and physical well-being. Those who suffer from anxiety often avoid activities which could aggravate feelings of uneasiness. This, in turn, can cause feelings of isolation. Anxiety and COPD. A major symptom of COPD is shortness of breath, otherwise known as SOB. SOB is caused by the chronic nature of COPD and can worsen, when a person is doing a task that requires increased energy, such as shopping, bathing, walking. When a person experiences breathlessness and becomes overwhelmed, they may avoid situations that cause this feeling in an effort to decrease or avoid their feelings of anxiety. Those who experience such anxiety may feel that activities which bring on the anxiety may not be worth doing. Often they feel the only way to decrease or eliminate anxiety is to avoid the cause. Because shortness of breath is a symptom of COPD, it is important that a patient find treatments that can help them cope in order to have a good quality of life. Coping and managing with anxiety. The steps on how to cope with anxiety are to identify the stressors, know which events or situations in everyday life that create or worsen anxiety. Understand how you react. Examples of reactions include panic attacks or fear. Recognizing your reaction will have an impact on how you cope with situations. Break the cycle. Being able to break the anxiety breathlessness cycle can lead to increased activity while managing anxiety. The cycle will be discussed further in the presentation. State what you need. Using an assertive approach to state your needs can help reduce anxiety about performing certain activities. Sometimes this takes some practice. You can practice taking an assertive approach with a family member. Integrate your coping strategy. Through different coping strategies, you can learn to feel more in control of your emotions. Slow down your breathing, decrease your muscle tension, thus reducing stress and anxiety. There are many strategies that are available to people who have anxiety and COPD. Sometimes it may require trying out different methods in order to find one that works for you. Learning to relax can give you more physical and mental energy. The anxiety breathlessness cycle. Anxiety makes you breathe faster, which in turn can lead you to stop any activity which causes anxiety. Decreased activity in COPD can lead to increased shortness of breath with minimal activity. Therefore, it is important to remain as active as you possibly can. Continuation of the anxiety breathlessness cycle. The first stage, COPD-induced shortness of breath. So shortness of breath is already experienced due to the nature of the COPD. Second stage, anxiety panic attacks, relates to what you are about to do or actively doing. This can include both physical and mental stressors. The physical stress the activities cause can lead to anxiety. The third stage, increased shortness of breath and anxiety, occurs when anxiety and shortness of breath are increased at the thought of a task or when you're actively doing the task. For example, the thought of going shopping makes you feel anxious because of the energy needed to perform the task. Fourth stage, reduced activity fatigue. In an effort to minimize stress and anxiety due to COPD induced shortness of breath, you may decide it's too overwhelming to go shopping, or you may have to leave the store without finishing your shopping. The following are strategies that can be used to help you from being stuck in this cycle. So you recognize your fears. Understanding what makes you anxious is the first step in controlling your reaction. Plan your activities in advance. Examine stressful situations and understand what you can do to thwart anxiety and shortness of breath during these times. One problem at a time. Trying to change too much at once can increase anxiety. Learn from your mistakes. Use past situations and events where you may have not met your goals and try again by employing different coping mechanisms. Maintain a positive attitude. Positive mental health is important to breaking the cycle. A negative outlook can impede your ability to think clearly and prevent you from finding solutions to problems. Learn to relax, easier said than done, but as mentioned, use coping mechanisms such as deep breathing or visualization can help with anxiety and shortness of breath. Even your pursed lip breathing exercises can help reduce anxiety and shortness of breath. Ask questions and find answers. Talk with those close to you about your condition. Furthermore, you should consult a health professional if you really feel paralyzed by these fears. Common medications for anxiety. If you feel that coping mechanisms and complementary therapy are not enough to control your anxiety, your doctor may prescribe medication. Anti anxiety medications help reduce the symptoms of anxiety, such as panic attacks or extreme fear and worry. The same effects can also be achieved through complementary therapy, such as yoga, running, or walking. A combination of prescription and complementary may also be a treatment choice. Common anti anxiety meds include Celexa, Zoloft, and Paxil, to name a few. CAMH defines complementary therapy as natural practices or products that have developed outside conventional medicine. Conventional medicine being uh, possibly a prescription medication. The three main categories of complementary therapy are physical therapies, exercise, yoga, bright light, light therapy, acupuncture, etc. Serotonin and dopamine are chemical neurotransmitters that play a part in our emotional well being. Exercise and light therapy can increase production of these chemicals. Nutraceuticals are vitamins and minerals such as folic acid or vitamin D. Herbal remedies, St. John's wort, etc. Just to be sure to check with your health professional because some of the herbal remedies can interact with your other medications, or you can ask your pharmacist. Although some of these treatments may work, they have not been thoroughly tested. As mentioned, physical exercise can help to alleviate anxiety and stress. For example, yoga can help to improve stress tolerance, meaning that stressful situations can seem more manageable. Not only does regular exercise contribute to a physically healthy body, staying active can greatly improve your mood as well. Know your limits. Even though exercise is a great way to decrease anxiety and stress, those with COPD should be mindful of their level of activity.